Hey guys, and welcome to Diabetic 365. And today we have a very special guest. She is Toby. She has been diabetic from 4 decades, from 40 years with type 1 diabetes. And she's very special because she's not just a diabetic but also a diabetic educator who constantly teaches others to live a happy diabetic life. So welcome Toby to the show. Hi, how are you?
Hi, thank you.
It's a pleasure to have you on the show today. So tell us, when were you first diagnosed and what was your experience like 40 years back when there were no modern tools like we have today?
I know, I've seen a lot of advancement. Boy, things used to be quite different. I was diagnosed in October, just in 2 months. It'll be 43 years ago. So there was a lot of different tools out there that weren't not even half as good as what we have right now. And how I was diagnosed was pretty typical scene of having flu-like symptoms and just being very weak and lethargic, thinking that it's the flu, and going back to the doctor's office and testing, the blood sugar to find out that looks like I have diabetes. And at that time, I had to be admitted to the hospital. That was the way things were, that you went to the hospital for a couple of days to learn how to manage your diabetes.
So in this whole 40 years or 43 years, do you have any kind of complications?
Not one hint of any complications. And I just went to my endocrinologist yesterday for my 4-month visit. I go every 4 months, regularly scheduled, and he checks me over with a fine-tooth comb because it's unbelievable. No hint of any complications.
No hint of So you have seen from where there are this big block of brick-like diabetes meters, testing meters. So you have seen like way 70s, 80s, 90s, and now 2000s. So what is the complete shift you saw in this whole diabetes industry?
Well, I was even before the meters. I was testing my urine with like a dipstick type of thing. That's how we were testing to see if we had glucose in our urine, which is not as accurate by any means because some people, it takes a very long time before they start spilling glucose into their urine. So it wasn't as accurate of a tool, and we also didn't have multiple injections back then either. So those are two advancements, simple advancements by having the blood glucose monitors now that you could tell what your blood sugar is at any given second, which is wonderful. In the olden days, you had to go to the lab and sometimes wait a week or longer before finding out what that one blood sugar was, that fasting blood sugar. And a week later, then a lot's happened since then for you to make any changes.
Exactly.
So we didn't have the A1C test to tell us what our results were over the average blood glucose for the past 3 months. And we didn't have, of course, insulin pumps either, which are a nice mimic of the pancreas. So we have advanced so much, which I'm very thankful for, because it's all tools for better management.
So what is the cultural shift you saw in this whole 40 years?
What did you say? I'm sorry.
What is the cultural shift you saw in this whole 4 decades?
Yeah, well, better tools that are out there, but at the same time, we've also had a tremendous increase of cases diagnosed with diabetes. So it's a little bit uneasy because here we have more people with diabetes, but yet we have better tools for managing.
So this question is like, since you were diagnosed very young, so was this type 1 diabetes that made yourself to become a diabetic educator to help the whole diabetic community, and did you take it to heart and you said, this is something I'm going to do for my whole life, I'm going to teach others, help others to live a better life?
Well, my turning point was in 8th grade. You know how those turning points you'll never forget type of thing? I was hospitalized. So that was only the second time that I was hospitalized. I was hospitalized at diagnosis. And then the next time it was around Thanksgiving time, and I had the stomach flu. So I ate something wrong. So it was some type of foodborne illness. And so because I had the stomach flu and couldn't keep anything down, they hospitalized me because of dehydration and, to make sure that I was getting back on track. And at that hospitalization, I met a dietetic intern, and she told me she had diabetes. And that was my turning around point because, one thing was that I saw that if I have diabetes, this is a job that I can do. And that's how I started thinking about it. And from that point on, I tried to get as many job experiences in the dietetic world as possible. And so that was my starting point, that I could help others because managing diabetes with diet is probably one of the toughest parts about managing diabetes, the part that people have trouble with. And it was like, if I could do it, I can help others.
To do it. Okay. That's very nice. So from then on, how did you make this as a whole complete lifestyle change till today?
Well, I think of it as 3 commitments, and they have to do with attitude. So the first commitment is reality. The second one is priority, and the third one is knowledge. So the first point is reality, that you have to realize that and accept that this is a chronic disease. It's kind of like an awakening. Yes, I have this chronic disease. There is no cure out for it, so I need to do everything that I can to manage it. So that's the first reality. The second part of the reality, too, is that this could have bad complications, too. So we really need to take this under our wings and do something about it. So the reality is the first part of it. The second part is priority, and that's a commitment that I have done my whole life. Having diabetes is my priority. There's a lot of distractions, a lot of things going on, especially, if you have kids, you have a career, lots of things going on. But this absolutely has to be your priority. And I have some examples of how I make it my priority. One is that I exercise every day. That's a priority. And it doesn't matter if it's weekend or holiday. Still, it is on my calendar, and I make sure that I fit it in. So we know that that's a really important management tool, is exercise. So it's a priority for me. It doesn't matter that we're going out to a movie or whatever, celebrating. I still make sure that I exercise. Another priority with food is when we're going out to eat. I either check the websites to make sure I know the carb information, or if we're going to family members or friends' house, often they ask, is there anything special that you'd like? So
Exactly.
I make it a priority to make sure that there is food there for me to eat, and if not, I bring my own, and I have no qualms about that. I pack my own, and you know what? So what? This is very important to me. And
Exactly. At the end of the day, your health is important.
Right. So priority is another piece of this commitment that you have to make. And then the third thing is knowledge. How do you even know what priorities to make? And you have to get the knowledge of the best management tools, the information about diet, information about exercise, information about your medication. Know how your medication works. Is it going to produce hypoglycemia? What do I do in different scenarios? So those are my 3 commitments.
So this is regarding your experience as a diabetic educator. So tell us some of the techniques that you employ to teach your patients to stay fit, healthy, and also mentally.
Mm-hmm. Well, the thing is, we know that, and it's again with reality, that diabetes is 24/7, every second of the day. And that's why I named my website Diabetes Every Day, because
and also mine is 365.
Right,
365.
right. Combine them both. This is it. It's every second of the day. You can't take holiday from diabetes. So knowing that, you don't want it to engulf all of your time, and that's what a lot of my patients feel like. Oh, this is so much trouble. But you make it as part of your daily habits. And so if it's a habit, it comes naturally. It's very easy and easy flowing, that it's not a problem to manage your diabetes if it's just part of your everyday habit.
And I know that you put in a lot of time with your patients and also all the endocrinologists and nurses too. But how do you encourage patients to become involved in themselves to cure their own diabetes? That's a really challenging part for a diabetic educator or any endocrinologist out there.
Mm-hmm. I use a technique called motivational interviewing, and that empowers the patient to make the choices that they feel comfortable with. Instead of me giving the long list of, you need to do this, you need to do that, I also believe in baby steps, taking small steps to making changes. So we work on one piece, and I use motivational interviewing, asking the patient just a couple questions, but letting them talk to see what would be comfortable for them in making those changes.
That's very good. Tell us a few things you learned the hard way in your diabetic life.
Yeah. But that question is somewhat of a difficult question, because I would say the only experience that I've had was more with resistance, and it was based on that knowledge commitment too. I had some of the knowledge about insulin pumps, and this was the new wave of how to manage diabetes. But I wasn't convinced that I should go on a pump because I was having good A1Cs. My blood sugar readings were good. There were no complications set in. And my endocrinologist was saying, well, I know this is the wave. I should be saying that you should go on a pump. But on the other hand, great, the numbers aren't showing it. So I needed to get some more knowledge, and I did. I used a CGMS, continuous glucose monitoring system, because my A1Cs were showing really good results, like 5.7, and like, oh, so why would we do anything different? But once I did that CGMS, we saw that something was happening. I was having fine blood sugars waking up, and then my blood sugars were going to like 300 and then bottoming out right before lunch. So because I was having some highs and lows, that's why my A1C was showing that I had good blood sugar control. But in reality, I didn't. For some reason, the medications that I was taking were not keeping me nice and balanced. So that was
Your final message as a type 1 diabetic and also diabetic educator to the whole community out there.
My message is very similar to what my website's all about, and that we understand diabetes is hard to do. Diabetes management is hard to do, but it is possible. And so my website's all about how to do diabetes management, and it's the how-tos. And I've done it in video form to show people how to, because a lot of people are just overwhelmed with information on paper, and so it's to fill in the gaps, to show people how to do things, because when you walk out of the doctor's office or the educator's office, sometimes you're just so overwhelmed.
Exactly.
So it's taking it day by day, and it's absolutely doable.
Thank you. Thank you, Toby, for being on the show and sharing your life as a type 1 diabetic and also as a diabetic educator.